we are interested in banishing our frown lines, our wrinkles, or our crow's feet, well, take a look here, because a new age-defying treatment claims that can knock years off your appearance without having to go under the knife. It's not invasive at all. Dr. Orla Grimes, who is a specialist in medical aesthetics and Ultherapy, joins us now to tell us all about it. We have our lovely model as well, Anne-Marie, who's here with us. Orla, you're very, very welcome.
Thank you, Maura.
To the show.
Yes,
now, Ultherapy, explain the principle behind it.
Well, Ultherapy is an ultrasound treatment. We use it as a once-only treatment to lift and tighten the skin on the face, the neck and on the chest also. Really,
really good. So you get very good results and it's not invasive. Let's take a look at the monitor here. These are the areas that you can work on, is it?
Yes, Maura. So here on the facial graphic aspect of the screen, we can see the kind of anatomical areas that are amenable to treatment with ultrasound. So as you can probably see, we can use ultrasound to treat the smaller areas around the eyes.
So even fine lines around the eye area.
Very nice for fine lines around the eye, for affecting a nice lateral brow lift, and for lines that bother people in the under eye area also.
Okay, so around here, what we might find like a jowl area, it's good at tightening that area.
Yes, it's very effective at lifting and tightening the jawline. So we can treat the lower face or indeed just the upper neck to cause that effect.
Now, I know you have some gel on our model here, and show us how the machine works, just for people at home, because as you said, it is non-invasive. But what do you feel when you're using the machine? What do the patient feel?
Well, patients generally feel a prickly type sensation. But it's just a momentary discomfort at the time that the treatment itself is being delivered.
So how deep can you go? How deep into the skin are you going now?
So with Ultherapy, we can reach depths that are operated upon by surgeons during a facelift.
So a millimetre?
Well, actually, no. We're actually treating to depths of about 4.5 millimetres.
Wow.
And that's a particular
deep into the skin.
Anatomical layer called the SMAS.
So when you have the machine on, this is rejuvenating our own collagen in the skin, is that right?
Yes, it is. It is. As we age...
Through waves?
Through ultrasound waves, yes. We're passing ultrasound waves through the skin, so there's no disruption of the skin surface. The ultrasound waves are travelling to various depths beneath the skin to stimulate the production of collagen and elastin.
So as you work away there, you're checking the machine, are you?
Yes, I am, because with Ultherapy, we can actually see what we're doing throughout the treatment. That's something that's quite unique to Ultherapy. And it's very reassuring as a practitioner to be able to see what we're doing, because we can then ensure that we're directing the treatment precisely and at the layers that we wish to target.
Okay, so you can see those layers that you wish to target, and you can see where the rejuvenation is needed most. Let's take a look at some before and after shots here. So the first picture we have here, and this is, you know, I suppose the reality is skin can get loose at any age. We start losing the collagen in our 20s, is that right, in our skin?
We do, Maura, yes. We have the process of collagen and elastin degradation begins in our early 20s.
God, it's scary. Look at this young girl. She's probably in her 30s. You can see that just a little bit under her chin here.
Yes. So
you can see it tightened in the second photo.
Yes, so that's a lady who presented in her early 30s. This is a more elderly lady, but both of them have been treated in the submental area, the area underneath the chin, and so we get a very nice lifting and tightening effect along the jawline.
And it's a very natural look. It's almost like you're just younger looking. Your younger looking self. There's nothing fake about it.
Yes, that's actually true, Maura. I tell my patients that they will be a better looking version of their most natural self, because it is actually a natural process that we're stimulating, the process of collagen and elastin.
You're recreating youth.
Yes, we are.
It's amazing, really.
Yes,
let's take a look at, and men as well. You've got a lot of men coming to you. Let's take a look at this guy here.
So this is a gentleman. Again, he's probably late 30s, early 40s, and he had issues with a little bit of, I suppose, laxity of the tissues in the submental area also. And as you can see in the after picture, he has a nice definition of the jawline.
You can see the jawline much more defined there. Can I ask you a question? Is that area around the jawline, is that one of the first areas that starts to fall a little as we age?
Well, it's one of the areas, yes. But I mean, aging of the face, in fact, all of the face is affected In stages, really, yes,
Okay.
yeah. But ageing affects not just the skin alone, but the underlying structures of the face.
That keeps it all up.
Yes, so that's why Ultherapy, by treating those deeper layers, is actually giving a much better lifting and tightening effect than if we were to treat just the skin alone.
Okay.
Yeah.
So as you work away there,
Yes,
you come in for a session,
Yeah.
and how long will the session take?
Well, between 30 minutes to an hour and a half. So 30 to 90 minutes, depending on the area being treated.
Yeah.
We can treat smaller areas. We treat, for example, around the lips for lip lines. We treat the eye area. Both of those treatments would take about a half an hour.
So you'll only need one treatment it's long lasting, much more than a year, that type of thing.
Yes,
is it?
it is. It's a one treatment protocol, and I suppose the technology is so advanced that one treatment is all that is required to get the optimum skin lifting and tightening effect.
And you can go back to work straight away?
Yes, you can. People have a treatment, they leave the office and they return to their normal life.
Okay, and then the results, will you see results immediately or will it grow with time? Because I suppose collagen is a natural growing part of our system, so that'll take a little bit. You'll see probably a couple of weeks, is it?
Well, if we take skin biopsies, we see the regeneration of collagen at about 10 days post-treatment.
Right.
But for the patient to actually visualise the results themselves, it can take 3 to 4 months because, as you said, it takes time. New collagen and elastin is being regenerated, and then that collagen and elastin has to reorganise itself.
Yeah. So your skin will get plumper as the weeks go by?
Yes, it does, yes. So patients see a very nice result at around 3 to 4 months post-treatment.
Okay, very good. And I know that it's €500 upwards, so depending on what you do. Okay,
Depending
really
on the
good.
area.
I like the fact that there's no downtimes. People are very busy these days.
Well, exactly. As you can see with Anne-Marie here,
we can't see anything.
There's no disruption of the skin surface.
No, there isn't.
So she may, if a patient has a full treatment, they may feel a little tender to touch in the weeks post-treatment, but other than that, there isn't really.
Can I ask you a quick question? What if you
effects.
suffer from rosacea or various skin conditions? It probably would help a bit, would it?
Yes, it often does. Yes, particularly because we're not just treating the deeper layers. We're also treating the dermis. The dermis being the factory of the skin. So if we can stimulate the regeneration of collagen and
what we can see in our faces when somebody
exactly.
sucks at you,
it will certainly help with rosacea.
Great. Yeah. Thanks very much, Dr. Orla Grimes.
Thank you.
And Anne-Marie, our lovely model as well. Ultherapy, if you want to find more about it and find a clinic close to you that provides the treatment, head over to www.ultherapy, that's ultherapy.co.uk.